Confusion over test results from COVID-19 testing were coupled with a general sense of relief around the Northshire at the start of this week of July 20th, with word that the overwhelming number of test results from the pop-up drive-by test sites in Manchester and Londonderry were negative. As of Monday, July 20th, 1,432 so-called PCR tests, short for polymerase chain reaction, where a nasal swab is inserted deep into your nose and is used to directly detect the presence of the virus, have been conducted by the state's Department of Health and the Southwestern Vermont Medical Center. And of those, only 3 have come back with positive results, or an indication that the person possibly is carrying the COVID-19 virus. So what's getting the test actually like? We decided to take a drive up to the Riley Rink in Manchester and find out. On Monday the 20th, and one of the last days SVMC was offering free drive-by testing at the rink, those services will now be moving to the hospital's Northshire campus, where the hospital hopes to be able to offer appointments online. It was a far different scene from the previous week, when cars lined up for a long wait. This time we drove right on through to the initial stop, where SVMC nurse Megan Cornell explained what would happen.
So today's COVID test is a nasopharyngeal. The test results come back in 3 to 4 days. If it is a positive case, you will receive a phone call. If it's a negative case, you will not receive a phone call. You can, though, go on the hospital portal and you can check your result. If you don't have a portal account, we can help you to set one up. Additionally, if after today's test, which is only testing for corona picked up today, if you develop symptoms after today, you would need to monitor your symptoms and would get another COVID test, assuming that you caught something that wasn't captured today.
Then it was around the corner to the nurses' station where Kim, one of the nurses, explained what would happen and then administered the test.
So you've never had this before?
I have not.
Okay, so this is the brush right on the end of this stick here, and it's going to go into a nostril. It's going to go to the back of your throat. It's going to hang out there for a few seconds while it collects some cells, and then we're done. So less than 10 seconds. It is a little bit uncomfortable. Your eyes will water and you might cough or sneeze, but it's pretty self-limiting. So that's about it. You ready?
Ready when you are.
Okay, do you want to pick which nostril I use?
I don't care.
Okay.
Your call.
Some people, if they've broken their nose in the past, it's easier to go in one side or the other. Open your mouth just slightly for me, and we're going to go right in. Here we go. I'm right where I need to be, and the countdown begins. This is where it gets a little stingy for your eyes. Just continue to breathe. 5, 4, 3, 2, and 1. Good job.
Whew. Yeah. Well, it wasn't so bad, and definitely bearable. But yeah, there is a bit of sensation, all right. Meanwhile, controversy continues over the conflicting results turned in by antigen tests used at the Manchester Medical Center, which reported 59 positive cases last week. A number later increased to 64. The antigen test is a newer and different test from the PCR one favored by the Vermont Department of Health, and the reports that many of them were testing positive beginning on May 20th was a big concern. Dr. Janelle Ettridge Sterling, a co-owner and practicing physician at the medical center, described their thinking about the tests during a press conference held Wednesday, July 15th.
The importance of a rapid test, which is highly, highly reliable, you've got a goal, is that we can mitigate. We need to stop active spread. You cannot do that if I have to wait 3 to 10 days to get a result back. Because most people think going home and being good means maybe just having a couple friends over. That's not enough. Right. We need to have total isolation. If we don't have people to spread this to, we don't have a pandemic. If I'm not spreading respiratory droplets to you, we don't have a pandemic. If I can pull you out of circulation really early, before you've had a chance while you're in your contagious phase to pass it to other people, let's stop that chain. But I can't wait 3 to 10 days. So we were really lacking in testing materials early on. PCR swabs, as we heard across the country, were very limited. We were doing PCR swabs since March. We've been using that mechanism. That's the only thing that we had. May, we were able to contract with Quidel that makes Sophia, that we can get this rapid test. John Mallard worked very hard because this is what we needed. I need a quick test that I can identify you. I can identify the enemy coming before you kill my people. I can't wait till you're on my field. It's much too late. You've already wiped out half of my team. So I need to know right now. And in the face of a pandemic, I would rather be wrong with a positive than wrong and let you go contaminate the rest of our country. So we worked very hard. We were very strict with the data. We want to make sure we're giving you accurate results. We are following up with a PCR where we have concern. We are making sure we're not missing the false negatives. The problem lies is that if we run out of the PCR swabs, well, I can't just stop testing. I need to have data. So now that we've been a little bit more vocal and are getting more PCR swabs to follow up with those antigen tests, that's exactly what we're doing.
But those results were disputed by Dr. Mark Levine, the state's health commissioner, on Friday, July 17th, at one of the governor's now twice-weekly press conferences. On Monday, July 20th, both Drs. Levine and Etheridge Sterling appeared on a program on Vermont Public Radio and tried to explain their approaches to testing and the seemingly conflicting results. They discussed the reasons why the results of the antigen tests conducted by the Manchester Medical Center and the state's preferred PCR tests could have been so different. That program can be heard on Vermont Public Radio's website at vpr.net. Dr. Levine concluded, however, that there doesn't appear to be a pattern of local community transmission or spread going on. We also had a chance to speak with Dr. Trey Dobson, the Chief Medical Officer of the Southwestern Vermont Medical Center. He talked about the test results and where things go from here.
So in theory, if someone tests positive, then you isolate them and you contact trace them, and then all of those people are separated and therefore not spreading the virus, and eventually we can stop the virus. The difference between this disease and some other diseases, not all, is this period where you're asymptomatic, either for the entire portion of your disease or for the initial part, and you're spreading it. So there really is a reason to test people who are asymptomatic. And the idea is if you can catch them, then before they see too many other people, they can be pulled out, they can be isolated and do whatever they need to do, work from home, and then get back into society. Of course, if they're sick, then we need to treat them. As you know, the number of hospitalized patients, let's just use Vermont, with COVID-19 is very small compared to the percentage of people who have tested positive for it. As a society, and certainly regionally in our practice, we need to move to continually reassess novel types of testing so that we can eventually get these tests in the hands of individuals, whether that's businesses and schools and homes, so that we can test people often. And as soon as they're positive, we can say, oh, we're positive, so let's quarantine and generally, or isolate in that situation. And generally, again, people are okay. They may need to be monitored for fever and muscle aches. Of course, if they have trouble breathing and get serious, then they need to come to the hospital. But by doing that, we're removing them so quickly from schools and from society that we can actually, keep this virus very low. So that's one. I'm sorry to interrupt you as the reporter, but I do want to point out something that I haven't had the opportunity to talk about, and even on VPR yesterday, it just really didn't present itself. But I completely understand everyone's fears when an outbreak occurs. And what I was trying to allude to is there are some things to give assurance to. So right now, when people think about an outbreak, they're thinking about early March and what happened when there were outbreaks in March. But we behave so different as a society today. if there's an outbreak around here, let's just say in Bennington or Arlington at a church, for example, or a school system or an area where people were meeting, that's very different than an outbreak back in March. Right now, when that happens, people say, oh, okay, so let's identify those people and let's quickly, the best we can, identify who they've come in contact with, which is mostly just family members. And let's quarantine those folks. And then we keep businesses opening and we keep other things open because we behave so differently. And in fact, it shouldn't really even be behaving before an outbreak or after an outbreak. The behaviors should be about the same. And so they're very serious. These outbreaks are very serious and the disease is very serious. And I want everyone to understand that I'm not belittling the disease and the effects on people. But I am saying that it's very different than March. And so our response should be calm, controlled, and moving on with what we need to do as a society. I know it's easier said than done, but it is true that that's how it should occur. And in other countries, that is how it is occurring. The ones that had it before us, they're having these outbreaks, they contain them, and we move on. Generally, when we have discordance among tests that are both accepted, then there is a problem with one of the testing mechanisms. I mean, that's the general theme. We've seen that before in most doctors have had an experience where they start getting some values in that they don't expect, and then when they look into it, there's a problem with the testing that's easily corrected or quickly identified and corrected. We don't know that to be the case in this situation, and I am going to let the state and their CDC be the ones to speculate and investigate that.
By Tuesday, SVMC had gotten results from 1,100 of the tests they had done at the Riley Rink since last Wednesday, and of those, only 3 were positive. Community spread was not underway in these parts of Bennington and Windham counties, Dr. Levine, the health commissioner, said at the governor's press conference on Tuesday, July 21st. For the GNAT-TV News Project, I'm Andrew McKeever.